Sherica Hymes, and I am the founder of the Total Woman Summit and your host for the Flourishing as a Total Woman virtual workshop series. It is a pleasure to have you join us tonight. Our special guest tonight is Dr. LaShaunda Massey, who is a licensed clinical psychologist, and she is going to be dropping some very strong wisdom and nuggets on us tonight as we discuss maintaining your sanity and managing your mental illness during this pandemic. So we are incredibly happy to have Dr. Massey with us. How are you this evening, Dr. Massey?
I am well. Thank you for asking.
Good, good, good. All right. So if you all would be kind and do us a favor and let us know in chat if you can hear and see us okay. Let me see. Somebody type and let us know if you can hear and see us okay. We have a room full of people. Yep, they said they can hear and they can see us. Thank you all so much. Thank you, thank you, thank you. They are very enthusiastic. We appreciate your participation. So, Dr. LaShaunda Poindexter Massey. Let me tell you guys a really fun story about how I know Dr. Massey, because you may wonder why I rock with her so hard. And it's not just because she's an amazing psychologist or because she's an amazing woman or because she's a woman of humanity. And I stole that from Dorcas, a good friend of mine, who I heard say that somewhere, but I thought it was such a powerful statement. But I actually know Dr. Massey because we grew up together in church and our fathers got ordained together. They're both ministers, we're pastors' children. So you could save all your jokes. We've heard them off. We don't
Much later, yes. We'll mute that.
We are certainly not interested in them. But that's how we know each other. We grew up together, and then we found each other again later in life. And so I'm so excited. She is someone who is very passionate about mental health and especially destigmatizing it in our community and in general, just mental health and making sure that ladies and gentlemen alike and children just really understand the importance of caring for your mental health, making sure people understand the difference between mental health and mental illness. And we are going to have a rich, robust conversation tonight, so be prepared to get thoroughly engaged with us. So, Dr. Mass, tell us a little bit about yourself and why you're so passionate about the work that you do.
Oh, well, I think the most important thing to say is this is year 20 in private practice. For me, well, almost year 20, year 15, we'll put it there. Years in the business, 15 years in private practice. But as a youngster, I was always curious about why people do the things that they do, and I always seem to have a knack for listening. So I guess at a very early age, I understood there must be a way to monetize this. No, I'm just kidding. It was much more about my motivation to understand people, why they do what they do, and to help them through struggles and be able to do well in life according to what their own desires and interests were. So it was a natural fit for me coming through the church. My mom was a nurse. My dad worked for was a warden of the prison, and it was about rehabilitation. So I just grew up in a space that was about service and enlightening people and bringing into a better space. It's just in me, I believe.
Yeah, so yeah, that commitment to service, absolutely, and I can certainly attest to that. It is the way we were raised. So let's get right to it, Dr. Massey, because I want to definitely use our time wisely. Let's talk about maintaining your sanity or mental health. What is the difference between mental health and mental illness?
I'm glad that you asked that, because I can say that in this time of this pandemic, this crisis, and I have heard the word mental health more than I have heard in 20 years of being a provider. Everybody's talking about there's going to be a mental health impact. You got to think about the psychological components and make sure you're taking care of your mental health. And it has given me so much pause, Sherica, because I am keenly aware through the work that I do that people don't know how to do that. That's not an easy thing to just say, oh yes, let me make sure I get in on that mental health taking care of thing that I usually do, because people usually it's been so stigmatized and problematic. And some of the reason for that is because people think about mental health and mental illness being synonymous. That people will say, I'm mentally ill, or better yet, I'm not crazy. So they don't think that there's anything they need to be dealing with in this mental health area because they don't have an illness. I want to make sure that people are thinking about this practice differently.
Wait a minute. Hang on, Dr. Massey. I want to make sure people are getting this. You seem to be going in and out. So
Going in and out?
Going in and out. Okay. Yeah, and turn it up as loud as you can because this is good information.
We'll turn it up a little bit louder. Okay.
Yep, and you're going to have to slow down. I know you talk really fast, but this stuff's good. People need it. We also
So turn it up and slow it down. Okay.
Turn it up and slow it down and talk a little bit louder. You got to use the cheerleader voice a little bit so we make sure you're getting it. So yeah, go ahead and continue what you were saying.
So the point was that people think of mental illness and mental health as synonymous. And because people say, I don't have an illness or I'm not crazy, they don't think about that they need to be dealing with anything about their mental health. I want to make it clear to everyone that mental health needs to be thought about on the same plane as our physical health. There are things that we do all the time to take care of our physical fitness. If it's the way that we eat or it's the exercise that we do, we are doing things all the time to take care of our physical health. And we go to the doctor either once a year for a checkup or when we have an illness and we need to do that. What things can you say you are doing regularly to take care of your mental health that are just part of your regular routine to make sure I am mentally healthy? And then that when I'm doing that, sometimes I may need to go to a doctor if there is some concern that I may have an illness, or I may need a doctor that helps me along the way, just like having a personal trainer when I'm trying to make sure I'm doing the right kind of exercise. I go and get a little professional support in that. So what I want us to make sure we bring forward tonight is that people understand taking care of your mental health needs to be a part of your regular routine, not just when we're in a crisis and a pandemic, and not because you're crazy and got an illness, but because it needs to be a part of what you do regularly to care for yourself.
That's so good. And then, so what does that look like? What does caring for your mental health look like?
I am glad you asked because that is something else that I've had a lot of concern about, that people really don't know what that looks like. I think that one of the things that I have thought about, even in preparing for this session, in the setup, it was said that COVID-19, right? Life, what did you say? Interrupted? Life interrupted. What came to mind as I thought about that from the mental health perspective, Sherica, was life's intervention. Life's intervention. I don't know if you all have seen those shows on TV when they do the interventions and they know that somebody's having a problem and there's lots of issues that they've been trying to get this person to hear and understand and they don't get it. So they stage an intervention and all the loved ones come together and they sit around and they trick the person into coming in and they pour out this love and say, we want to help you, get some help. Listen, life said these people are running ragged. They are too fast, too slow, too tired, too stressed, too fat, everything has been going on in this world, too money hungry, too social media crazed. All of this was going on in this crazy world, and life said, listen, the whole world needs an intervention. Sit down somewhere. And so I say, how do we do that? Is that we have got to begin in this time learning what it means to take care of our mental health. And I'm gonna present it to us as we go through the night in some ways that I'm hoping will stick with us, but I'm gonna use it in this way. I'm gonna talk to you tonight about rest. That's going to be our acronym that takes us through. I need you to take that word literally. So one of the main things you need to do to take care of your mental health is rest. Most of us in our busy lives do not take time to rest. Now notice, as I say that, Sherica, that I didn't say sleep. Because sometimes when you think about rest, a lot of people always think about how many hours of sleep did I get? You may not be able to always orchestrate a nice 8-hour sleep. Or you may say, I'm someone who hasn't needed 8 hours of sleep. But what you do need is consistent, regular, rejuvenating rest. So that's thing one. We've got to make sure we are prioritizing rest.
Well, listen, so we're going to get into this, and I will tell you, for those of you that are new to the Total Woman Summit platform or initiative, let me just say something to you. The Total Woman Summit was created to empower women through education, connection, and community. And this is a part of our initiative is educating you with the information that you need from the experts to really empower you to make the best decisions or lifestyle changes or choices that you can make so you can live in wholeness and in wellness. And we're very transparent too. So let me tell you, I'm going to go ahead and humanize the story a little bit for you. So rest, Dr. Massey really helped me to understand the concept of rest because I am someone who is very achievement oriented. And before I really took the time to do the work, the heart work, the HEART work, I was doing a lot of hard work. I was accomplishing things. I was putting accomplishment over pain. I was putting accomplishment over trauma. And I wasn't dealing with that. So I needed to deal with all of those things. I needed to deal with the fact that I had been raped when I was a teenager. I needed to deal with that. But no, I was on a performance treadmill, just constantly accomplishing. And so I was not getting rest. I was going to sleep, but I wasn't getting rest. And it was manifesting itself in my body, in the form of illnesses. It was manifesting itself. I was just not in a place of wholeness. So can you talk about that a little bit, Dr. Massey?
Yes. I will definitely talk in terms of, I like to use the word performance treadmill. You know, that's one that I like to use. That oftentimes part of the reason that we don't prioritize rest, part of the reason why we don't get that done is because we are busy trying to achieve. We have decided that achievement is the thing that makes us whole, that makes us worthy, that makes us have a reason to exist. So we're always trying to make sure that we are able to achieve. So we're constantly trying to get to that next best thing and running ourselves to make sure we are achieving. We're holding up the banner of accomplished woman, or we're holding up the barriers that we need to break down, and we got to make sure we can get through the glass ceiling. So we're constantly holding ourselves in this space where we have to achieve. And sometimes even that performance treadmill is about avoidance. We are not, as you talked about, dealing with those things we need to deal with. So we're not mentally healthy because we're busy stuffing things under the rug. And we are tripping over this rug that keeps getting constantly thicker and thicker with everything we're sticking under it. But we're not learning to deal with those things so that we're not simply performing, achieving, riding, making sure we can get it done. We are not learning how to really deal with things. So part of taking care of your mental health is getting off the performance treadmill so that you can have a little time to rest, and then other things better. So let me push that a little bit for everyone as we talk about this. When you think about rest, even in this time, I want you to think about it more in this space of relax. Because when we do that, when we are able to relax, that is the place from which we can relate. Sherica, you just talked about, I didn't need to understand that I needed to relate to some things in my past that were really barriers for me. That is one of the ways that you can really work on your mental health, is to relate to the things that are happening around you, things that have happened with you, things that have happened for you. When you think about this life in this pandemic that we're going through right now, you need time to relate to what just happened. That is real. It is real for us to be afraid. It is real for us to be confused. It is real for us to be uncertain about what is happening right now. So if I'm just kicking back at home like this is a vacation, I'm not being honest about what's really happening here. And that is just an example of, and I want us to be sure that these things that we're talking about tonight are not just mental health in crisis. It's mental health all day, every day. You got to relate to the things that are
around
you.
So you make a very good point, and I want to make sure that we repeat that. That's why I'm really typing these notes for you guys, so you'll have this, so you definitely jot it down or screenshot it, however you got to live your life. do that part. But I want to make sure that we revisit something that you talked about in a moment of truth and transparency that I just had with the participants, was just because you are still accomplishing things and you are still reaching goals doesn't mean that you are maintaining your mental health. Can you talk a little bit about that to really make sure people understand that the two don't necessarily run parallel?
Yes, that's a very good point, because oftentimes we have gotten confused that the way we define ourselves, our worth, is through the things that we accomplish, that being the strong one or being the accomplished one means that I'm okay. So when people see you achieving, when they see you doing well, that means I'm well. And the reality is a lot of people are doing well in spite of. They're doing well even though they are not well. They are doing well at the office and coming home to an abusive marriage. That's happening. They are doing well. They're showing up and getting that promotion, but had to take off work because they had that miscarriage that nobody knows about. They're not well. There are things that are going on that can happen. You don't have to be, listen, we don't have to be totally broken down to be not well, right? Let me use another medical analogy.
Hold on, wait a minute. I can't let you go over there. That's too deep. That's too deep. You do not have to be broken down to be not well. And I can tell you, let me put some humanness to this for you. I did not look like what I was going through. My hair was still done. My face was still made up. I still look good, and I prided myself on I don't look like what I've been through. And we say that, especially if you're churchy or you grew up in church, you can really start to lean into that, like that should be your reality. No, I was broken up on the inside. I had 5 major surgeries in 4 years because my body was responding to what I would not deal with. So I was dressing up the pain, I was dressing up the trauma, and not dealing with it. So you do not have to be broken or look broken to not be taking care of yourself. So go ahead. I just didn't want to gloss over that. Can you talk about what you mean when you say that, Dr. Massey, and how you've seen that show up in practice?
You see it show up because that is happening. What I often see, even in my adult clients, is that I often meet people at a space where the doing well has started not to cover the not well anymore. The coping strategies of making it and being okay and getting through start to break down. And there's a time where I don't understand, everything I used to do is not working anymore. And those holes start to show up. And so what we're understanding is that accomplishment in and of itself doesn't make you well. And so people are so focused on what are they doing? How does it look? I have these things that demonstrate that I'm well, but I haven't really taken time to understand what well is for me, because accomplishments don't necessarily mean happiness. They don't mean that. And needing to understand where I'm not healthy, again, doesn't have to mean that I am broken down in the corner, cannot function, right? Because we're talking about, again, using the medical model, and I do that because that's much more common to people. There's spaces where you get a common cold, right? And you continue to go to work, you continue to get that report out, you continue to take care of the children, you cook the dinner, you do all of that, you take a couple of Tylenol PMs, try to get you a little bit of rest, and you hit it again in the morning, because I'm not well, but I'm still functioning, I'm still accomplishing things. We are doing that with our mental health all the time, telling ourselves, well, I got it done, well, I pushed through, well, I'm gonna be all right. And what's happening is we are still
the push through. Wait a minute, Dr. Massey. Hold on, the push through. So what I'm hearing you say is that you actually can be using accomplishment or the performance treadmill as a coping strategy?
Yes, ma'am. Yes, ma'am.
How many of you, let me ask them by show of hands, how many of you have been using accomplishment or have in the past used accomplishment as a coping strategy? I'll go ahead and start. In the past, I used to use that. And sometimes because it was so familiar to me, when I'm sliding back over into it, I'm so blessed to have some emotional intelligence and self-awareness and some therapy that I can pull myself back. But when I get in too deep and I can't, I just make me an appointment with Dr. Massey because I used to use it. So we have a lot of people raising their hands that they did that. So yeah, I'm sorry, I just wanted to make sure that I pointed that out.
And know that I'm not at all saying that accomplishment is bad and that we should not be driven and we should not excel and achieve. What I'm saying that it should not be a trade-off, that I shouldn't be trading my mental stability, my health for accomplishments. I should be able to maintain them at the same time. I should be able to value them at the same time. And when I'm doing that, that is part of what gets me to healthy. That's when I'm better at setting boundaries at work. When that boss tells you that you need to get something done today that you know you're going to need at least 2 days to get done, and you just say, okay, because you're used to just push through and make it happen. That's going to make me show up well. How about if I said, well, actually, that's going to take about 10 hours and there are only 2 more hours left today. I know I'm going to at least need all day tomorrow to get that done in the manner that we want to have it done. So can we move that deadline to Friday? What if I said that? Then I have time to go home, do the meal, go to bed, instead of put the kids down and stay up another 12 hours to get this report done and report back to work on 2 hours of sleep.
That's good.
But is that the best way to get it done? Have I not then traded best for this accomplishment? And everybody might praise me. That was amazing. Girl, you turned that around. Yeah. But now I can barely water.
Right. You turned it around at what cost? At what cost? So far what we understand is that you should be managing your mental health in the same way that you take care of your teeth, in the same way you take care of your eyes, in the same way you take care of your body, and that you should be resting. And resting does not mean sleep. We'll get to what that acronym means a little bit later in the session. But
well, the first one was relax.
Oh, the first one was actually relax. Okay.
It was. Relaxing to relate to what's happening in the right now.
Mm-hmm. Okay. Got it. Got it.
I want to highlight there, Sherica, is in that space. One of the things that we often don't pay attention to when we are needing to relate is what is our emotional place. I've heard you reference emotional intelligence a couple of times. Unfortunately, many people are not at all in touch with their emotions, let alone impacting some emotional intelligence. What do I mean by that? Here's something else, a little cliche that I've heard, and I don't want to step on any toes, but I got to say it as a professional. I hear people saying it's okay to be okay. And we want people to accept that it's okay to not be okay, to not be okay. It's okay to not be okay. And so people are grasping onto that. That's right. I can say that I'm not okay. Yes, but that's just the beginning of the story. We can't stop there with just an acknowledgement of I'm not okay. We got to pursue that a little bit more. I want, when someone tells me and gets to the place where they can tell me or their friend or a significant other that I'm not okay, we do need to unpack that a little bit. Why are you not okay? And what does not okay mean? Are you sad? Are you frustrated? Are you overwhelmed? How can we really unpack that so we can do what? Do something about it. I don't want you to be able to say I'm not okay and that equals you're on your way to balled up in the corner and can't function because you're not okay. I want you to be able to pause so you can relax and relate in that not okay, but relate to what? What am I feeling? What's going on for me? What do I really need? Listen, we could take a whole session on people being confused about what they really need and what they've been chasing, or better yet, what they've been accepting.
Yes, and let's talk about that. Let's unpack that a little bit. So I mentioned earlier in the broadcast that I found myself in a situation where I had dealt with trauma. So what I had to work out in therapy, because I was not okay, even though I looked okay, was I had unforgiveness. I had some hatred. I had some resentment. I had some personal and self-guilt. I had all of those things that needed to be addressed and worked through. I had to define why I wasn't okay, why it was showing up in my body the way it was showing up, why I was not at ease and not able to rest. I was going to sleep, but I wasn't really resting. So I had to deal with all of those things. And I've identified a couple of things that could be happening. I was sad, too, sad for the little girl in me that happened to, that I wanted so much justice for, and I wanted to reclaim my time. I had bitterness in there. So can you talk about maybe some other things people may be feeling, Dr. Massey, that when they start to define, I'm not okay?
Well, I think that puts us back in the space of what is happening during this pandemic, where we found ourselves forced to sit down and pay a little bit of attention to self. Part of what we're working on in this space is that people are struggling with, I can handle this. When you are in this space, there's no performance to go and do. There's not as much get out there and get it done. And then you find out, so what I find that is happening a lot for people in that space that you just talked about is feeling guilty for not being on 1,200, accomplishing 1,000 things, even in this time of trauma and crisis that we are in. I heard someone say it well when they said, you're not working from home, you're at home during a crisis trying to work. Because this is a different kind of thing that we are going through. So there will be some who are able to use this time to jump into a passion project, or maybe start a new business, or write a book. But listen, that's not what everybody needs in this space. So that's part of that relaxing and relating to self. Sherica might be able to put together a whole virtual workshop during this time of the pandemic and keep the Total Woman Summit rocking. And what I may be able to do is make sure I have a little bit more time to sleep in, because I've been getting about 3 hours of sleep regularly. And in this time, because my first meeting is not going to start till 10, I'm usually in the office at 7, I'm doing good to catch up on that rest. Am I weak? Because listen, I've watched some things that people are saying, and it's like that second part, if you're catching up on your rest or reconnecting on some maybe DIY projects around the home, it's almost like we're giving you a pass to do that. Okay, you can't get a lot done, you're not, it's all right, you can sit down. We understand it's too much. Listen, no, it's not. I'm like, sit down, rest, relax, relate. You don't have to be out here on the performance treadmill in a crisis. Relax and relate.
To be busy, you do not have to be busy, people. And what I have found incredibly interesting during this time is how so many people are uneasy being with themselves, not missing the connection, because we are human and we were created to really sort of connect with one another. That's not what I mean. But some of the reason why you are experiencing some of this uneasiness is because you have not reconciled and resolved things with your inner self. Can you talk a little bit about that?
So, Sherica, that takes us right on into the E of our rest here, because E is going to be engage. What I have found when people are busy, they are not hardly intimately engaged with anything. There's a little bit here and a little bit there, and I'm running over here and I got to get to this next thing. Everything gets a little bit, and very little do we really take time to engage in. So what I want you to understand about this concept of rest, that part of your mental health is to be able to have the wherewithal to be intimately engaged in the things that you're a part of. That's important.
What does that mean, Dr. Massey? What does that mean?
Well, it means thing one, as you just said, is self. Am I intimately engaged with myself? If I don't even know what I'm feeling, then there's no way I'm engaged with myself. If I'm chasing that I think people think I ought to have, then I'm not engaged with myself, I'm engaged with someone else's interpretation of who I ought to be.
Ooh, wait a minute, stop. We can't gloss over it. What did you say? You said if you are intimately engaged with someone else's interpretation of who you ought to be, you are not actually intimately engaged with yourself. Somebody throw a mic down, throw something, somebody. Because that's a whole word. We just walk away right now. That right there. That right there. How many of you, by show of hands, find yourself being intimately engaged? Thank you, Raquel, for dropping that mic. How many of you, by show of hands, find yourself intimately engaged with someone else's interpretation of who you are? See, people throwing laptops and mics. Just throw yourself. Do whatever you got to do.
Because listen, I would drop one of those real world stories that you were talking about. You know, we just had Easter in quarantine, right? My family normally goes to my parents' house and my in-laws' house on holidays and just eat up everything. My sister's on the line. She can testify when she and my mom are cooking. I am sitting on the side with a laptop or something, supervising. That's all I do. Listen, I had to cook Easter dinner. I am very much in touch with myself that I am not a domestic. It is not working. COVID-19 is trying to turn me into a domestic. I'm rebelling. I'm not accepting this. That's not who I am. But listen, I had to cook that Easter dinner, and everybody's kind of like, she really did that. And I was like, well, I can cook. I just don't like to. It's just not something so that's not my definition of me. I understand that some people, that's who they are, and they love it, and they want to get in that kitchen, and they want to do that, and they can work miracles in the kitchen. I think it was good. I'm saying, I think it was a good meal, but I'm saying, after COVID-19, I will not, listen, mama, get off the couch. I will not be doing Easter dinner in Timor. That's not me. I'm not engaged with that.
I love it. I love it. And if you are having difficulty trying to figure out how to get intimately engaged with you, chances are there is some. This is hilarious. Her family is rocking her out in this chat. Y'all cannot see it. For you. If you are having challenges really being with yourself or being alone because the voices in your head are getting too loud, that's really when it's time for you to start considering going to do the work. And I want to tell you something about therapy before we start defining mental illness. Therapy is not easy. It is not comfortable. It is scary. You will have to go back and revisit the things that you prematurely buried before dealing with them. You will have to dig them up, and that takes work. Many times I left, I felt like I had been in a fight, even though I left with tools and resources, doing that kind of deep work. How many of you are really tired or sleep good after you cry, by show of hands? That's what it felt like. I had to go in there and dig deep and really dig deep and deal with some things and deal with how I felt about them. And it was a lot, but let me tell you something, that hard work, that hard, H-A-R-D, heart, H-E-A-R-T work, set me all the way free, and it was worth it.
Sherica, I am so glad you said that, because another thing that I have found when people are trying to gather this concept of taking care of your mental health, they want to liken it to things that are all pleasant and cherry, and I'm going to have a nice bath, hot bubble bath, and a glass of wine, and I'm going to get a massage, or I'm getting my toes and nails done. Listen, those things are self-care, and we should do those things, and they can contribute to your mental health. But that's not all it means to engage with yourself and deal with your mental health. Some of the work that needs to be done in mental health is, as Sherica just said, that's hard work. And you got to do the work. If you follow me on social media or anything that I post, you always see me hashtagging do the work. Because this is a process that you got to go ahead and hunker down and engage in the process. Again, let me use a physical example. If you're going to get that beach body that you want by June, maybe August this year, got a little more time, ladies, got a little more time. If you're gonna do that, you gotta put in the work at the gym. Those last few burpees, those are gonna hurt, right? You do a few more sit-ups, you're gonna feel that burn, but you're gonna get the result because you put in the hard work to get there. Mental health is very similar. Sometimes I gotta do some hard work. I saw somebody comment there that sometimes when you're saying no, it's taken offensively, and people don't get it because they haven't learned to do that. They haven't learned to accept no's, because usually those of us that are on the performance treadmill, sweeping in with our capes on, healing the world and making things wonderful, You're not supposed to say no when they put the bat symbol in the sky. You're supposed to show up because your light is on and we need you. We have to teach people to receive no's better. And that's part of that mental health that we're doing. And that's part of the hard work that you got to be okay with. I've got to set some boundaries, and some people are going to resist that. They're not going to be okay.
Yes, so you have to be okay with that. And I will tell you that is a revelation. One of the things that I was able to work through in therapy, because I'm someone who has really high self-awareness, right? And I'm very intuitive. And so I was internalizing that other people weren't considering me the same way I was considering them. And what I worked through in therapy with Dr. Massey was people do not respect what you will not enforce. And so I was responsible for establishing my own boundaries and enforcing them. It is no one else's responsibility to enforce that. They don't even have to respect them. You have to enforce them. So they can choose to respect them or choose not to engage with you. So be very clear on that. And then this morning, this afternoon in our session earlier with Dr. Anderson, we talked about making sure that you had boundaries, balance, and consistency, because you have to consistently enforce those boundaries. So those are some really good nuggets for you, and make sure if you guys have questions that you drop them in the Q&A so we can answer them. So now I think it's a perfect time. Oh, I'm sorry. Go ahead. Sounds like you were about to say something.
Yes, I was just going to jump in on that. You mentioned the word balance, and I'm glad to hear that you all talked about that earlier, because I want to highlight that a little bit as we go into what this S means. Because something else that I have learned clinically is that people confuse the word balance, having balance in their life, with equality. That everything that I do has to be created and maintained equally. And that's almost impossible for you to give everything the same amount of attention all the time to the fullest extent. That goes very counter to the intimately engaged we just talked about. So people are often confused about balance. I'm trying to make sure that if I'm a career mom, that I'm spending just as much time with my sons every day as I am on the job every day, so I can have this balance. And then I'm a wife too, so now everybody down to a third. And now and then I got to go to church too. And it's a choir meeting tonight. So now everybody's down to a fourth. So the problem is here in this trying to create a daily balance, that everything has to be equal all the time. That is an impossible standard we're trying to hold ourselves to. So I want you all to make sure when you're thinking about balance, I want you to think about another word to pair with that so that you don't confuse yourself. Our S is going to be synchronized. What we need to get better with is allowing the things in our lives to coordinate well, that they need to be synchronized, that they need to be working well together, which doesn't mean that they are always equal. They need to be harmonious. They need to work together. Let me use a choir example for that, because I was on a choir chat earlier today with some folks from my high school. Hey! That ain't my ministry. We're going to let my sister do that. But anyway, the point is, when you think about a song, right, everyone is singing the same song in a choir, but they have to do it in the right harmony for it to sound good. The note that the sopranos are singing is not the same note that the altos are singing, although we're singing the same song, right? So I need you to think about your life in that way. These things that are coming together to make your life have to be synchronized. I got to know what the harmony needs to be in these things. So it may be that on this day where I've got a full day at work and I've got 12 clients and I'm doing that, I might get home a little late. So I may not be able to do full out dinner tonight. This might be a pizza night, because I'm gonna stop by there on the way home and do that. But the next night, I may be able to get off a little early and do the full dinner. Things are still in harmony. I didn't have to get it all done to the same extent every day equal. That's not possible. You're holding yourself to a standard that's gonna wear you out. You won't be able to relax. You won't be able to relate to things. You won't be engaged because you're so quick in and out the door. How many of you have popped into this place and I'm out of here because I got to get to that one before that one ends, and you're stretching yourself too thin because you're always saying yes, and I've got to be loyal because if I don't do that, Now I'm no longer a loyal person. So I'm running around, spreading myself thin, trying to equally give to everything all day, all the time. Pause, ladies.
Again, performance.
Set your
Performance.
You got to do something different. I'm
something
not
different.
for these 4 hours. And after that, Sherica, like I've heard you talk about your do not disturb at night. Tell us a little bit about how you use do not disturb on your phone in the evenings as a way that you're synchronizing your time.
Absolutely. So when I finish working, or if I decide it's not just reserved for the evening, I will do it in the middle of the day. If I feel like I need a moment, I have do not disturb on my phone, and I have 2 different do not disturbs. The do not disturb, one do not disturb that I can just activate at any time is the one where I am not accepting any calls, any texts, any alerts, any nothing. Sometimes that's for 15 minutes, 30 minutes, an hour. Sometimes it's 2 or 3 hours. And I just pray over everybody that I love that if they have an emergency during that time, they're going to be all right. Because right now I am waving a flag for my own self, and I show up for my own invitations and requests for help and needs for my own self. And then I have the one at night that I use when it's time for me to relax and wind down. I use my do not disturb, where if you are not in my immediate close family or close circle, then they have an exception where they can get through, but not on text messages, just on calls. And so I can rest throughout the night. And so I use both of those things when I need just a minute to step away from myself, and also when I'm trying to go to sleep and get rest, because I don't want to just go to sleep. I don't want to just be in the bed. I want to get rest. So I do enact both of those things, and as often and as frequently as I need to. And quite frankly, in the midst of COVID-19, this is not normal. I have found that I have been enacting my do not disturb where everybody can reach me, sometimes multiple times throughout the day, because it's so much. I'm getting so many calls or so many texts or so many requests, and people just want so many things. I just need to step away. I just need to step away for a minute. So yeah, so that's how I do it. Absolutely.
And that's how you can understand this concept of synchronization to create this, that you're not confusing balance with equal. Balance means that things are where they're supposed to be in the right order, right? In the right levels of connection. And we've got to have that flexibility. That's another one we got to put in there, because I've got to be able to reset sometimes, or I got to change that up because it didn't go as planned, so that I need the ability to be flexible. Because one of the things that happens, we are putting ourselves on such tight schedules and making sure that we are pleasing everyone. As somebody wrote, we putting our capes on, saving the world. We don't have time for something to go wrong. We're not ready for it. Totally throws us off our game. We are confused. Everything is up in the air because we've been so tight on this, got to do it like this. When something happens, we're not ready to adjust. We're not ready to resynchronize. It doesn't happen just once. Synchronizations are something that you set up at, during your resolutions in January in 2020. You tried it, but listen, you're going to have to synchronize again and again, because after you get through resting and engaging, you might find out that you need a little bit of adjustment, because what life happens, somebody in this whole world intervention threw us a pandemic. And so you're not gonna be able to do that. You're not gonna be able to get that done. Listen, I will tell you all this. One of the things that you're going to have to do to be mentally healthy is understand that adversity will come. It's coming in every life, a little rain must fall. I'm sure you've heard that old adage. The point is, it's going to happen. There will be adversity. If you're so tightly wound, so focused on your perfection and your loyalty and your showing up and being devoted and achieving and accomplishing, when something breaks that, interferes with that, interrupts that, as you told us, COVID-19 has done, life interrupted. Are you ready for the interruption? Do you have a little bit of room to accommodate adversity? It is coming, right? I like to tell people that being strong does not mean you're not strong because nothing bothers you. You're not strong because you just get through it. You're strong because you can understand and work through the adversity and be better on the other side. So your strength is in the get through, not the avoidance. Some of us are extremely focused on making sure we avoid anything that could go wrong. And I'm strong because I can, and I just get through whatever happens. I'm all right. It doesn't faze me. Listen, if it's not fazing you, you are not engaged.
Exactly. And all of that pushing through is avoidance. Some of that is avoidance. It is not resilience. It is, and it's detrimental to your well-being. So I want to make sure we answer some questions real quick.
Yeah, we want to work through, not just push through. We want to work through.
Yeah. Mm-hmm. So we're going to answer 2 questions, and then we got to define, because I told people these hours go by so fast. This is good conversation. So we want to define mental illness as well so people can differentiate between the two. But let's answer 2 questions very quickly. Any suggestions for working mom guilt? I literally don't want to go back to work full time when this is over.
Working mom guilt. Does that mean that I'm guilty about the fact that I work? I think the best answer to that fits us back into this rest that we were talking about. If you're feeling guilty, that makes me wonder, are you really in line with what you want to be doing? Whose definition of woman, of mother, of professional are you living up to? Because if you really don't want to go back to work, is that a real thing for you? Is it a possibility that maybe you could enter into a part-time position at this stage in your life because that's what I want to do? I recognize I've missed too much time with my children, and although I do value my career, I want to synchronize this a little bit better, Dr. Massey. Maybe it's time for a reset. And that again doesn't mean that it's got to happen tomorrow, that you don't have to show up Monday saying, you know what, I don't want to work this career no more, I'm quitting. And you haven't taken care of the fact that you are taking care of them. And now we got to turn the car in and move it to a trash can. We're not going to do that, because that's part of what synchronizing is about. That I can say 5-year plan, right? That I want to make sure some things are happening, right? That will allow me to be in that space I say I want to be in. So I was thinking about that when I was doing a little work on turning 45, and I said, I am on, coming out of 45, my 5-year plan to 50. These are some things I want to make sure are present in my life before I reach this 50. So there are things that I'm already thinking about that I want to have done, but I can't enact them today. They are not for today. They are for the place that I'm going to. So I'm synchronizing so that I can engage in things that get me to where I want to be. Because I can understand that this has been good for a time. There's something else that needs to happen at another time. So I would encourage anyone who is trying to deal with that guilt of being a career mom is one that you forgive yourself in that space, because that guilt is not serving you at all. You need to have an awareness that we can have both. You can have a very powerful career and be actively engaged in the lives of your children if you are doing a good job of all these things we've been talking about, making sure that you're getting adequate rest so that you can relax and relate to what's around you and engage intimately and synchronize that in the way that we need to have it done. Again, when we are so busy on that performance treadmill, trying to make sure we're doing so well at work, we probably don't have enough time for the children the way that we would want to. So if we get better at managing our need to perform and excel at such an extreme level that is way too high for anybody's well-being, you might have time to manage those things. So I don't ever want any woman to feel that in order for you to have joy as a mother, in order for you to have fulfillment in your career, you got to choose one or the other. We talked about some hard work, right? I didn't say it was going to be easy. I told you some of the stuff that we need to do for mental health is not about ease. It's about outcome. That I got to participate in the process to get to where you need to be. That's what people mean when they say you got to trust the process. What does that mean? That means I got to get here and work because I really genuinely believe it's going to get me to where I need to be. So that space, don't feel like it's a choice, ladies, that you got to choose between your career and your children, that you've got to find the right harmony for those things, and you have to define that.
Absolutely. And you've got to start defining what success looks like for you in each of the roles that you play, and not taking on other people's definition of success. Then you'll be much more comfortable making those choices. So here's another question. let's see. Is perception or managing perception a big part of managing your mental health?
On so many levels, it is. Because part of, even as the question that we're talking about dealing with guilt, oftentimes what we're dealing with in life is perception. So perception is a huge part of managing your mental health, because you've probably heard people say perception is reality. And what that means is what I believe to be true usually is how I'm going to respond to that thing, whether it's true or not. If I believe that, if I feel that you hurt me, if I am truly feeling hurt, it doesn't matter what you intended. If I felt hurt, that's the reality that we got to do. My perception, if you did that to hurt me. So it is that perception that I'm dealing with. So that can happen on so many different levels, that managing perceptions are a part of our mental health, because perception is reality, that I've got to deal with that. So if someone is perceiving me as loyal because I am always there for them, whenever they ask for me, I'm there. I'm Johnny on the spot. I drop everything for them. So I've allowed the definition of loyal to look like Johnny on the spot. I've allowed that, and I've embraced that that's what it means for me to be loyal. But does loyal look like I've got to be there every second, each time you call me right on the money? It may look like that sometimes, particularly in a crisis. But if you need me to go shopping with you and help you pick out some nice outfits for your vacation, I might really love to do that with you. But what if I'm not available until Sunday afternoon instead of Saturday when you call me, because my kids have swim meets all day? I'm still loyal to you as a friend, and I want to share that experience with you. But it's okay for me to say, oh, girl, yes, let's do. You know, I love a good shopping trip. Can we do that Sunday? I can say that because I've allowed myself to say the perception cannot be the reality that I live by, because my perception matters too. So in part of managing mental health, we got to be able to understand what perceptions are other people operating on, and ultimately, which ones are we operating on ourselves? I can't hear you.
You can't hear me because I put myself on mute.
Don't put yourself on mute. You're the host.
Okay. I was talking good too. And many of you have asked me how you can get this information. That's why I put that in the chat. But we're going to get through all of this. And so we're going to answer the questions that I currently have in the Q&A. And then we're going to define mental illness. I'm going to tell you right now, we're probably going to go over a little bit over 8:30. So get your water, get your mind right just a little bit. But I want to do this topic justice. So this person says, how can I effectively communicate to my family that sometimes I am not okay? How can they support me while social distancing?
Okay, so part of that is we're trying to, again, accomplish a whole lot at one time. So we say, how can I communicate to my family that I'm not always okay? So that means I have not been communicating that to them already. So this is going to be a new concept for them. And I want them to show up right for me through social distancing while in a crisis. So the first thing we're going to do is not try to make 4 things happen at once. So I can understand. So part of what I'm doing is breaking that down for you, that I need you to see that that's really 4 different steps that you're trying to manage, and getting frustrated or getting confused or uncertain about how am I going to make that happen? Because it's not one simple thing of just telling them that I'm not okay. You've got to communicate it effectively. They've got to understand. Now they got to adjust behaviors, and we got to do that in a very strange land of social distancing, because normally that might look like a hug and baby, I didn't know, I'm sorry. We can cry on each other's shoulder. We can't do that right now. So there were so many layers to that. So one of the things that I want to talk about when we talk about being able to relax and relate and engage intimately is understand that some of these processes that we are engaged in have multiple steps. So thing one is being able to be honest about how you're feeling, and be able to give some legs to I'm not okay. We talked about that already, right? We want you to be able to say I'm not okay, but go a little bit deeper in that. Because when you are able to really talk about why you are not okay, that will also help you define what what you need to get better. And so you can talk to people. They first got to be able to digest you're not okay. If that's new to them, they're not expecting that. They're not sure what to do. Even if they want to support you, they don't know what that looks like. So part of that, learning to communicate about yourself more effectively, is giving people a chance to adjust to something new, because this is new for them. And sometimes they may need a little instruction on what you need, because our needs are different. When I'm not okay, I might need a shoulder to cry on, and that's okay for me. When I'm not okay, I may need some time to myself, so I need everybody to just kind of give me a minute. When I'm not okay, I might need a social outing, so just come pick me up and let's go do something to take my mind off of it. If you are better able to communicate what you need, then people can show up for you better. So part of your family can be able to support you're not okay, even in social distancing, is you help give information on what that would look like. And here's the thing, you may not be entirely sure, because this is new for you too, to be talking about, I'm not okay, and I'm saying it out loud, and I'm trying to figure out how can I get people to support me. So you might have to say that part. I'm not sure what it looks like. I know I need you all's help, and I want y'all to be there for me. And I'm gonna be thinking about it, and you think about it too. Share some ideas with me, because maybe we just check in every night with a good night, or maybe we say, well, we're gonna set up a Zoom meeting and watch this movie together on Hulu to find out what's happening with these little fires or something that's going on Hulu. But you may need to work together to figure out what support looks like, because that fourth level is what support looks like in this crazy situation that we're in, because that might look different than what it would look like in normal circumstances. So one of the things that I just want to unpack about that is, remember that some of the things we're trying to accomplish have multiple layers, multiple steps, and you've got to be willing to go through all the steps and not try to go from 0 to 100. We can't do that. If I'm a couch potato and I've just bought myself some new tennis shoes and I want to become a runner, I can't sign up for next month's marathon. I'm not ready yet. I got to do some things. I may want to run a marathon eventually, but can I get just a mile in first? Can I get used to doing that? And that, I remember being very young. You mentioned Sherica. I learned very early that you need perfection before progression. I'm not talking about being perfect. What I'm talking about is being able to master something, enjoy that moment before I try to move on to something else. And if I'm so focused on running the marathon, I won't be able to put any value on the fact that I moved from sitting on my couch to running a mile consistently under 5 minutes. That's a major accomplishment. So part of what we got to be able to do is to break things down into manageable chunks so we can accomplish them and feel that joy of accomplishment before we move on to the next thing, and recognize that these things take time and practice and effort. And when I'm bringing somebody along with me too, they might not have the same processes as I have. They might not have the same time or commitment or intensity or willingness. We got to work with people that are working with us.
That's so good. We got to work with people that are working with us. So we've already discussed, for those of you who know that I'm a stickler about starting on time and ending on time, we've already discussed that I knew that this needed to be a much longer segment. So we are going to go over a little bit, because we've been spending all of our time on maintaining your sanity and caring for your mental health. And we do not want to do this topic any disservice. So we are going to go over. So you can stay with us, great. If you have to log off early, listen, there's no penalty for being early leaving, so dismissing yourself early. But we're going to answer these questions because we're here to help. So let's talk about, I see some more questions, but I want to make sure that we define, what is mental illness?
So when you think about mental illness, and we started our session talking about being able to separate mental health and mental illness is the disease process. So you're talking about there are certain things that we experience in the area of mental health that are really about disorders, that are really about illnesses, and they are true and they are real and they need treatment. So what we have to understand is, using our medical model again, that we have a space where we are dealing with just what keeps us healthy, right? And we're maintaining our diet, and we're getting the right exercise and going in for our checkups. And I do those things to keep myself healthy. I'm watching my salt intake or different things like that I'm doing to make sure I'm staying healthy. But if it is discovered that I have diabetes, Now we're in an illness place. I've got to do some things with my health care that are different than if I were managing without an illness. Mental health is the same way. I'll use depression as an example. There are many people who experience depression as simply the emotion, the sadness that my dog died, I was so depressed. That's depression as an emotion. And we do all experience that, because you hear people say that everybody's been depressed. Everybody deals with depression. Everyone doesn't deal with depression, the illness. That's a different category, because the sad mood, the emotion of sadness, is only one thing that goes into the definition of depression, the illness. So mental illness is a set of disorders, of diagnosable problems that need a different kind of treatment than what I'm doing just to maintain my mental health. So let's be very clear that illnesses are different and they are real. That we want to be able to understand that when people say you have a mental illness and people struggle with, it's all in your head. Of course, it's a mental illness. Where else would it be? In your foot? It's in your head. It's part of your psyche. That's where this all resides. And we got a whole conversation about what's going on in this powerful mind. That's the T, by the way. We didn't finish that. Rest, the T is think. You got to be able to know the power of the mind. And so on the furthest end, Sherica, of mental illness is where there is disturbance in the thought process, where there's a disconnect with reality. And that's what people think about when they think about mental illness. They think about that space where people are crazy in layman's terms, right? That's one corner of mental illness psychopathology, right? Where we're in that place of that. And that's what people think about. That's only one. There are all of these other disorder categories that exist: depression, anxiety, PTSD or post-traumatic stress disorder, substance abuse disorders. All of these things exist at the illness place. So we can go through where we get beyond problems in our mental health that can be very severe and problematic without getting to the level of illness. But then there are some that are really in that category of illness, and they need a certain level of treatment as well.
Thank you so much. And that is a perfect segue into our next conversation, is about COVID-19. I have seen, and we've talked about this, a lot of people posting on social media attempting to be humorous, but talking about some of the coping strategies that they're using to deal with either being quarantined or self-isolation or to stay at home or safer at home. And some of them are posting that they're drinking every day, that they're using some other coping strategies, and that's the only way that they're getting through. Can you speak a little bit to how, if you are needing to indulge in some of these things daily to make it, how that may be a representation of mental illness, and how these things are dangerous?
Yeah, we definitely want to be aware of that. It is unfortunate, as I mentioned, that in this time where we're hearing the terms mental health a whole lot more, and we can't deny, I can't deny as a clinician in this for 20 years, that there isn't a stigma associated with mental health and with mental illness. People don't gladly talk about or openly talk about their mental illness as they would a cancer or a diabetes. They're not as willing to do that because society is not as kind about that. And so what we find is we are more comfortable in the mental health space so that we can deny that there's illness, but you do want to be concerned when you find yourself doing things that you know are not healthy for you, yet you do them to be okay, which probably means you're not okay. We've been talking about that. Why am I not okay? Why is it I need a glass of wine every day? If I want a glass of wine, that's okay. But am I clear though, when I've crossed the line between I'm just wanting one and I need one? I find that I can't get to sleep if I don't have that glass of wine. I find that if I'm not spending a little bit of time on my social media for hours, just trying to find some positive message, I'm looking for somebody to pour into me, that I might need a relationship with a therapist that can pour into me and help me deal with some of the brokenness that I really have going on. So what we don't want is to mistake mental health and doing the work, doing the hard work of healing yourself and dealing with the stuff that is troubling you, whether it is in the space of your everyday mental health or in the space of illness, that we recognize that we need professional attention in those spaces. People with credentials, you all, and I'm not just tooting my own horn, but listen, I worked for this DR. It means something. And there's a knowledge base that goes with it that is not the same as a Post-it note. I can go buy a book that has wonderful quotes on what you can do to stay positive. I can tell you all day to stick some Post-it notes on your mirror, but listen, that's not going to do the work, right? As we just talked about, it's okay if you understand you need to say, you need to embrace, it's okay to not be okay, that I can say that I'm not okay, but then what? You got to do more than that, because I don't want you to stay broken. I don't want you to stay not okay. I don't want you to stay beat down or constantly engaged in relive. I want you to get better. I tell my clients all the time, if we do this work, if we come in here and you have to stay in therapy every week for the rest of your life, one of us is doing something wrong. That is not how this is supposed to happen. I want you to come in here, do the work to develop the skills and move on. Check in with me every now and then for a booster session, because adversity is coming. Remember, I told you that. We might have to catch up and do a little bit more, but be willing to accept that we can't look for quick and easy mental health care, just like we can't look for quick and easy medical care. Everybody doesn't have the answer. There's some reality to, there are some who cannot give what a licensed therapist can give. It's not just like talking to your friends. It's not just like sitting up with your significant other. There's a science to what we do. And we need to be able to embrace that and know that when we're doing that differently, because there are different levels. You may find that I need a life coach. I need somebody that will really help me organize some things about understanding my career or what my job strengths are or how I'm going to manage that. You may not need a clinical psychologist for that. That's probably not what I do. I will tell you that's not what I do. There are some people that do that. But when you find yourself dealing with something as real as anxiety, I'm having panic attacks. I didn't know what it was when my heart was palpitating, my hands were sweating, and I thought I was having a heart attack. I've been to the ER 4 or 5 times. They keep telling me there's nothing wrong with me, and they say they think it's anxiety. What is that? That is crazy. That's not crazy. That's real. It's a real illness, and I am pretty certain most of your girlfriends don't know how to help you deal with a panic attack. Not because they don't love you, not because they're not trying, but probably if I'm getting anxious and freaking out, come and get me and taking me to the mall is probably not going to help.
Or meeting me for happy hour. For happy hour. Yes.
I'm not going to happy hour. I'm stressed out.
No.
I don't want to get out of this blanket.
Exactly. And I want to also point out, you make such a valid point, is that if you find yourself needing to talk to your friends way too frequently about the problems in your life, you need a therapist, because you should not be abusing your friendships or trying to make your friends your therapist. You really want to get the help. And I think this is a perfect time for us to really define and the difference between a social worker, a therapist, and a psychiatrist. Can you talk to us about that? A social worker, a psychologist, and a psychiatrist.
Well, there's a lot of different levels to kind of each of those things that you talked about. And I'll kind of try to give a basic distinction between some of those things. So let's start on the psychiatrist end. Those are MD doctors, medical doctors that deal in the area of psychology, and their primary goal is to determine what kind of medication is necessary to help you manage this illness that we talked about. So you likely wouldn't be seeing a psychiatrist unless you have a diagnosed condition for which medication is deemed appropriate. That's what psychiatrists do. I'm a psychologist, so I do therapy. So the work that I do, I am not going to prescribe medication, but I too am a doctor, not a medical doctor, a doctor of philosophy, a PhD doctor, or sometimes a PsyD doctor, doctor of psychology. And what we do is to do the work of mental health treatment and mental illness in that area of therapy, where we're looking at working through the thoughts and the behaviors and the feelings and the situations in ways that are related to the illness and other life processing problems that we're going to deal with. And so we're in that space. Social work is a lot more complex. in terms of there's some different levels that you have clinical social workers who do similar things to what I would do as a therapist. And there are social workers who do many other things in terms of connection to resources or at more of a community level or everyday life problems more so than maybe a clinical illness or in that area. So when you think about those things that are available to us, there's so many different things that people can expose themselves to. And so you want to have an understanding of what it is that may work best for me and what I have going on. Because what you don't want to do is show up in the wrong place. If you're in need of medication, you don't want to be in the office of the social worker only. Maybe you go there too, but that's not the right level. And so, and there's no wake up in the morning and have a handbook on that. You understand all of those things. You got to touch base somewhere to get a better understanding of what is the appropriate thing that I need. So I think there's important to know that there are differences in those spaces. And as we are getting to a comfort with connecting with the area of mental health and psychology and those things, we can start to better understand what are these different resources that are available, because everybody isn't a therapist, and that's not the only thing that's available in the work that we need to do to make sure we're being mentally healthy.
Thank you so much I thought it was so important for us to have that conversation. Dr. Otis said he's representing at the
Dr. Otis is in.
You are. Thank you. He's a psychiatrist. We appreciate him. One of Dr. Massey's colleagues, and of course, Summit friend and sister, Dr. Angela Anderson's husband, who's with us earlier today. So that's a perfect segue into us talking about what should you be looking for? What character traits? What should someone be looking for when they find an appropriate provider? And what does that relationship look like?
That is a very good question, because there's so many schools of thought on that. But what I would say to that is there is no replacing the impact of the therapeutic relationship. You have to be able to find a therapist that you genuinely feel a connection with. And there are many things that go into that for each individual person. For some people, there's an ethnicity match. That's a necessity, that you understand part of you. In order for you to feel comfortable with that therapist, we got to both be African-American, because I feel like there's some things that I would have to explain and that someone of a different ethnicity wouldn't get. So I'm definitely going to be looking for that. There's nothing wrong with racial matching. That's not bias. That's not prejudice. It's an understanding of what may be needed. It may be a male-female thing. You may find that I really think I can relate best with a woman. And so I'm going to be looking for a female therapist. So part of the work, and you may not hit a home run on the first try. You may have to go in and find out that there's some different things that you want to do. I would also caution people to be very careful of building a therapeutic relationship that is super comfortable and easy. If you go to therapy and it's like a girlfriend talk, and it's just like I'm sitting with one of my girls and I, we just have a good cackling old time, and you go out and rah girl, have a good time, probably not your best therapist. Probably fun, but probably not the place where you're going to do the hard work. So I would definitely say I probably have many clients that will say I push them to do some hard work, and they're appreciative after the fact. Not that they don't feel a certain level of love and connection, but they know that I'm going to say we got to do the hard work. And you're going to get better for it. There's a box of tissue always on the table in the office, because you might have to cry in this work.
You will need it.
You may get angry in this work. All I do is validate. All I do is say, yeah, you're right, or I can understand, and it's going to be okay. You'll get through it. I have not helped you resolve anything. So if you find yourself in a therapeutic relationship and it's happy, joy, I'm going to caution you that might not be the place that you're going to get the real work done.
Thank you so much. I think it's so important that we had that conversation. And we're going to start to land this plane. But first, we're going to answer this last question. It says, I care for my parents, ready to relocate because I'm drained and feeling so overwhelmed. When I speak to my friends who lost their parents, it makes me feel guilty of leaving. I just don't know how to get to the point of not feeling guilty. I feel sad many days, stressed, no freedom, and bound down with shame. I am not okay. I'm the only child who's healthy. Everything is on me. I don't know how to relax or be free. How can I become mentally free. I'm the strong child. That's very complicated and complex. So I know you're going to at least get us started on that answer, but I think some one-on-one is going to need to
I was checking the time. I was like, I think we need a session. Because, and I say that jokingly, but I say it honestly as well. That is a lot. You heard me saying earlier in one of the other questions, when you listen to that, there are so many layers of things that are of problem there that need to be worked through. That, and so I will hit just some of the highlights of that first. Of course, as a child, you want to do what you can to care for your parents. So one of the first things that I would ask you to do is let's clearly define need. What do they need? Not what they're used to, not what I think I need to give them, what other people have told me I ought to be doing, what other people have done for their families, because you've got to be okay with, as we were talking about earlier, defining some things for yourself. So for you to say, I want to get out in life and try some things does not mean that you don't love your family or that you don't love your parents. Now, of course, if they can't get from point A to point B without you being here and you rush off and pursue your acting career in LA and they can't even get to the doctor's appointment, that would be problematic. Yes. But if what they're needing is groceries, because they don't like going to the grocery store, or maybe they don't drive anymore. Listen, they got grocery delivery services now. I can be in LA and order the groceries and have them delivered to my parents' doorstep. So I'm making sure they are still eating, but I'm not having to be there physically. So part of what you want to be able to do is really be able to determine what is the level of need and how that works for you. So when you're able to do that, that you can say, okay, this is what I am doing to meet the need. So let's first just be clear on what their need is. And then we can talk about who can assist. If you are the strong child, is there truth to there's certain things that your siblings cannot do? Or have they just not done it? Can we identify some things that you could share? Maybe there are some spaces that are very limited to what you have and what you have access to and what you can do because you are the strong child. And so I need to hold on to these 4, but maybe I could share these 3 over here. And it's okay to be able to do that. So I just want to say in response to that, let's understand that that's a lot that you are trying to deal with and unpack, and you can't do it all at once. Let's break it down into some layers and figure out what we can do and recognize that it is to have some desires and things that you want to do for yourself is not an automatic indication that you are disliking or dismissing your family. It can all work together.
Do you guys probably have Massey on the screen. I just wanted to let you know that I think my internet connection just went down.
We did lose you, and I saw this big message that said you are now the host. I was like, oh, all right.
Yeah, you keep hosting because I'm trying to get back in, so that's good. I just wanted to make sure the people didn't lose you too. So good. I mean, it's just so great. Awesome. I'm just trying to get back in my own webinar. I mean, imagine that. Anywho. So, yes, so as we get ready to wrap up, Dr. Massey, tell us again what REST stands for. And you may want, I've already typed all of it in the chat, but just give folks one more time what it stands for.
Yes, we talked about rest, that we are going to take literally. But rest, again, is going to mean that we relax and we relate, that we're taking the time to relate to the things around us and knowing that we want to engage, because somebody just mentioned, what if I got so relaxed that now I'm not ready to get back into it? We've got to know that there's some engagement that happens in there. Well, so you're going to be choosing what things you need to engage in. And in order to do that, you can synchronize so that you're making sure that things in your life are working in harmony. That balance is not about being equal, but balance is about being in harmony, that you're able to synchronize the things that are important to you and engaging in that and doing the things that are sometimes difficult. And T is think, that we're making sure we take time to think and use the power of our mind, that we're so busy in the doing and getting going or the avoiding or the pleasing that we don't take time to think it through. So we got a T in there for think, and then we're managing our time well when we do that. So that is what rest is all about.
Awesome. Thank you so much. Wait a minute. Hold on.
And now you got to bring it back.
Okay, can you guys hear me? I mean, this technology, it is something else. Gee, Louise. Okay, I'm back. All righty. So you guys have the definition of rest. So, Dr. Massey, can you tell us, I know that your book is full and you're currently not able to see new clients. We know we wish everybody to come and see you. But if you guys need to say, if you guys need resources, what would you recommend for folks who have, after this conversation, realized that they need a therapist or that they need to seek out a psychiatrist?
I mean, one of the places that you want is in your insurance booklet and finding out who's available, and maybe you can get some feedback from persons like myself on who may be good that your insurance accepts. Word of good, touching base with someone that is in therapy or has found a therapist that they like, because you want to be able to sometimes get some personal input on what people have thought and connected with. So I think one of the most important things is being willing to put in a little research to figure out who's available and what they may have to offer.
Okay.
And not look at social media for your
therapist. Do not look on social media for your therapist, people, okay?
Don't set up a session with Dr. Phil to show up on his show on TV. Don't do that.
Don't do it, please. Okay, someone asked, we'll answer this last question. Are online therapists effective too? If you mean that in the space of telemedicine, absolutely. Like you have to see your therapist or your doctor right now via video, like we're doing via Zoom, absolutely. But if you mean that in a different way, I'm going to say no, but I'll let the professional tell you her answer to that.
No, I completely agree. One of the ways that people are finding it easier to connect with the possibility of mental health is through telehealth, and there are some online therapists that are available. I will admit I'm old school. I prefer life in the office and having that one-on-one connection and being there present with the person that I'm dealing with, but that's not always an option. So having therapy online or through a telehealth setup is a viable option, particularly for many people who have tough times with their schedules and things like that. But again, you want to do the research, you know. Even in that, I would prefer that it is of the style where you still build a relationship with a therapist and not where you simply call in there's someone new every time, where you're kind of doing more of a crisis management than a process and development space. So think about that as well. If there is a crisis situation and you're just calling in to a kind of hotline style thing for one time, this is major, I need some help right now type of thing. But otherwise, you would even want an online therapy option to include an ability to build a relationship with someone that you're connecting with the same person consistently.
Absolutely, so good. So Dr. Massey, while people cannot come and make an appointment with you because you are booked to capacity, she's booked and busy, but we're happy about that because that means that people really are getting comfortable with getting the help that they need. Tell us though, because you are dropping nuggets of wisdom and working on a book and always encouraging people and inspiring people, where can people get more information from you, or if they want to book you to speak, where would they do that?
The easiest way to do that would be through my website, drmassey.com. You can go there and learn a little bit more about me as a clinician and some of the other hats that I wear and ways to book or get information. And we will be working on that book to have on that.
Absolutely. So you said drlpmassey.com, correct?
Correct.
All right. And people can also follow your therapist page on social media. What is that on IG?
What is that on IG? DRLP Massey? dr.lp on IG.
dr.lp Massey on social media. So make sure you go to her website if you want to book her or if you want to have her come speak. But that book is dropping soon. I can tell you where that book will be. It will be at the Total Woman Summit, the annual event this September. And if you have not signed up for the Summit Inner Circle, that's where you're going to get all the information and news about upcoming workshops, webinars, and stay in the know about these playbacks. So you definitely want to do that. You can sign up at TotalWomanSummit.com for the Summit Inner Circle. You should be also following me and the Total Woman Summit at Total Woman Summit on Instagram and at Sherica Hymes on Instagram. And you are absolutely correct. We are shamelessly plugging so people can stay connected and looped in. And do you have any final words for people before we say goodnight?
The final word I would have tonight is that I want everyone to remember that this situation that we are in currently is new. So no one is an expert on managing this. You want to be able to plug into your resources so that you're getting support and building an understanding for how to manage this time. Recognize where you are and be able to slow down in this moment and come out of this different. Let's not just rush back to what it was. What I have definitely seen clearly in this moment is where we were was not a good place. You heard me start out the night saying the world gave us an intervention. This is your intervention. Use this time wisely. Take some time to slow down, relax, engage with yourself so that you can connect better with this world, with the people you care about, with the things that are important. Some of that synchronizing is about putting things in the right order again, making sure that we do this. So let this moment not simply be about crisis. Let it not just be about, I was overwhelmed by the COVID and I was shut down. I like it when I hear people say you are not shut in, you're safe in. Can you be safe in your own home? And if you're not, let's fix it so that we're not rushing back to what was, but we're coming out of this stronger. We're coming out of this more enlightened. We're coming out of this ready to prioritize our mental health, because that is, the mind is the foundation. That's your boss. The mind is the boss of everything else that's happening in you. If you can think it, then you can make it happen. So let's do the work of think so that we come out of this better than we came into it.
That was so powerful, so powerful. Dr. Massey, it has been a pleasure having you on tonight. Thank you for giving us the gift of your time, the gift of your expertise, and really helping us better understand how we can manage our mental health and the difference between mental health and mental illness. What will happen for those of you that joined us, and thank you guys for being so gracious and staying on. And
Amen. Thank
continue
you.
to talk to us. And we have gone over an additional 30 minutes, but only because it was necessary, not because we don't respect your time. But as soon as this is over, you're going to get a pop-up window that asks you to do a survey about tonight's conversation. We love feedback. Please make sure that you give us that feedback. Thank you all so much for joining us. Don't forget to join us tomorrow as we talk about the COVID-19 from a medical physical health perspective, and we're really going to be debunking myths, separating facts from fiction, getting information and answers from doctors that are on the front line. So make sure that you register for that session, and we will see you later. Have a great night. Have a
great evening.
Thank you so much.